So these are great for oral formulation. So what are these formulations that exist? And so we've got estrogen only birth control formulations, and they can be kind of subcategorized into low, regular, and or medium and high. There are combined estrogen and progesterone formulations, and there's two packaging, kind of a 21-day regimen, so it's oral daily for 3 weeks, followed by 1 week off, and a 28-day regimen, which is 21 daily oral tablets of hormone, followed by 7 daily tablets of placebo. And that placebo could be nothing. It could be just filler. It could be sugar tablets, or it could be iron. And so, depending on which brand of birth control, you can get different types of placebo pills. And of course, there are phases of formulations, which we'll discuss in a second. So these phases are really these combination tabs, and they can be monophasic, biphasic, or triphasic. Okay, and so they all contain varying amounts of estrogen and progesterone. The monophasic is kind of one dose of estrogen and one dose of progesterone. The biphasic is the same amounts of estrogen and 2 different doses of progestin. And the triphasic has 3 different doses of estrogen and or progesterone, plus or minus placebo. And so examples of each of these are listed here by their brand name. We typically don't go by their generic name because they're all estrogen and progesterone. So this is probably, let's say, probably the only time in pharmacology where you would actually call the drug by its brand name. Of course, when the patent expires, you can see a different name come out, and it's really just however much estrogen or progesterone is there. But yeah, this is probably the only time that you'll actually see brand names. You don't need to know the brand names. You need to know that these different phasic combinations exist, but you don't need to differentiate orthonovum from orthocycline. Actually, by the name, you can actually tell what it is. So, triphasal, trilevelin, orthonovum 777. These are obviously all triphasic. Biphasic are just orthonovum by itself. Monophasic, Nordet, orthocycline, Yasmin. These are all monophasic. And so, just to kind of introduce the concept to you, there's tons of birth control formulations out there. Neither is good or better than the other. They're just different formulations based on what the patient would like. And we'll kind of talk about that in a few minutes. And so this is what some of these look like. The monophasic one, here's an example of orthonovum 135. Biphasic, here's an example of Nikon 1011-28. And triphasic, here's trinorenal 28. And so you can see really clearly here's those those placebo tablets. And so these could be, judging by the color, they're probably iron supplements, but they could just be fillers, and they're typically dyed a different color, so that the patient knows that these are the placebo ones. So there's no hormone in here. And of course, the triphasic, here we're looking at blue and white tablets, indicating probably estrogens and progestins for the different colors. And so just to kind of review, your estrogen-only drugs are listed here, and your progestins are listed here. So what's the drug list look like? Well, ethinyl estradiol is basically like the main, probably the only estrogen that's really out there. And then there's different progesterones that exist. And of course, structurally, they're all very similar. And you don't really need to differentiate for the exam. You don't really need to differentiate, any of these. I think just knowing estrogens and knowing progestins is enough. This lecture is a lot more than you ever needed to know, but it's the only time you're ever going to learn it. So we give it its all. All right. And so in terms of the combination oral therapy or the combination oral contraceptive, sometimes you'll hear them called COCs. We've got a 21-day and a 24-day regimen. And the different formulations are listed here. It's all really the same thing. A lot of this really comes down to what the patient would like and how adherent they are to a regimen. Because remember, we said, in terms of having successful oral contraceptive therapy, it's going to rely on the patient taking the right pill at the right time. So if you have a patient who routinely forgets to take their medicine, um, it's really going to be problematic in terms of this drug being, the most efficacious. And so they have to strictly adhere to, taking these medications on the proper day. If they, if they're off a day or if they're off 2 days, um, the efficacy is going to go down severely. All right. And so the 21-day regimen would really just be 3 weeks of oral tablets followed by 1 week off. And so in order for this pill to be successful, they have to remember at the end of that 7th day to start their new regimen. And so if they forget, it's going to be really, really, really harmful. Likewise, the 24-day regimen, which is listed here, would have a couple days off too from therapy. There are other types. We've got these extended cycle COCs, and so this is 84 days of hormonal therapy. So 84 days of E2 and 100 of also levonorgestrel, as well as 7 days of placebo. Okay, and then there's another formulation of 91 days. We've also got continuous cycle COCs, which is basically a yearly contraception. 365 days of tablets. We've got other ones that are listed here as well. So what do these preparations look like? We've got estrogens and progesterones, of course. And here's kind of the treatment protocol in terms of, the patient says that they would like an oral contraceptive pill. What are the things that you need to take from the patient history? Okay, and so I kind of like this slide. And it looks at basically some of these underlying health problems that would really be best avoided by a hormonal use of some of these drugs. So you can kind of read through this loop by yourself. I think this is interesting. And so there's different ways to initiate therapy. You can have a quick start, which they, basically they take the tablet, the first tablet of the COC as soon as possible, regardless of what day on the cycle they're on. There are some patients who prefer to take it on day 1, so take the first tablet on the first day of menses. There are some patients who do Sunday starts, so you take the first tablet in the COC package on the first Sunday after the beginning of menstruation. And so if menses begins on a Sunday, you start that day. And so, there's different reasons for starting on different days, depending on which drug and which method of initiation. Many practitioners and patients like to use another method of birth control for the first month of oral contraceptive therapy. And so, that other method would most likely be a male condom, just to play it safe, because there is going to be a little bit of a lag phase as these hormones adjust, and you don't want to chance it. Where's the